What are some common misconceptions about erectile dysfunction? This is a question that often sparks a lot of debate and misunderstanding. Many believe it's a condition that only affects the elderly, or that it's a psychological problem, not a physical one. However, these are myths that need to be dispelled. Erectile dysfunction, or ED for short, is a medical condition that can affect men of all ages, and often has physical causes. Now let's delve into the world of Pde5 inhibitors, a type of medication that has revolutionized the treatment of erectile dysfunction. Pde5 inhibitors, or phosphodiesterase type 5 inhibitors, are a class of drugs that work by blocking the enzyme Pde5. This enzyme is found predominantly in the corpus cavernosum, the sponge-like regions of erectile tissue in the penis, and it's responsible for the degradation of a molecule called cyclic guanosine monophosphate, or cGMP. The story of cGMP is a fascinating one. When a man is sexually stimulated, his nervous system releases nitric oxide in the corpus cavernosum. This nitric oxide triggers the production of cGMP, which causes the smooth muscle cells to relax and blood vessels to dilate. The result? An erection. However, the Pde5 enzyme can break down cGMP, preventing or shortening the erection. Enter Pde5 inhibitors. These drugs, which include well-known names like Viagra and Cialis, stop Pde5 from breaking down cGMP. This allows more cGMP to accumulate and persist longer, leading to more pronounced and prolonged erections. It's important to note, however, that these drugs don't create an erection on their own. Sexual stimulation is still necessary to start the whole process of nitric oxide and cGMP production. So, what have we learned today? Firstly, erectile dysfunction is a medical condition that can affect men of all ages, not just the elderly, and often has physical causes. Secondly, Pde5 inhibitors are a type of drug that work by blocking the Pde5 enzyme, allowing cGMP to accumulate and persist longer, thus facilitating stronger and longer-lasting erections. But remember, these drugs still require sexual stimulation to work. These insights are not only crucial for understanding erectile dysfunction and its treatments, but also for dispelling the common myths and misconceptions that surround this condition. Knowledge is power, and in this case, it could be the key to improving sexual health and relationships.